after removing the tooth, if something is still inside the bone or cyst or something like that, you go with curate and try to take it to remove it out. Okay, I will explain fast.
Yeah.
This one is for any angle. It is for the lower. This is for the wisdom teeth. Lower.
Wisdom teeth.
Yes. The last one.
Lower.
Lower wisdom teeth.
Yes.
This one is for the upper wisdom teeth.
Upper.
Can you take this?
Ah, yes.
Upper.
Give us one.
This one,
Put this in this
Yes.
if the tooth is in here, that means it is for the left side of the patient.
Left
This-
side of the face.
This is the upper. All right.
Yes.
This one always for lower. If you see it is closed and you catch it like this is for extraction of the remaining roots.
Lower.
Lower.
Yes.
All right. This is for extraction. Sorry. This is for extraction of. This is for the roots. This is for the upper roots.
Upper.
All right.
Yes.
Yes. If you see two teeth here, this is for the first and the and second lower molars.
Take normal. Yes.
If this one is not touching, it is for first and second lower premolars.
Primo.
If it is touching, it is for remaining roots. And you can use this one also to remove incisors also, the lower incisors.
And so on.
Yes, but once it is closed, it is for roots. See the difference? This one is closed, so for roots. This for first, second premolars and incisors.
This is a cowboy forceps, yeah?
Angled is for lower. The upper, it is slightly curved. The way of you catch, it is like this. If the teeth is on this side, you extract the patient this side. First, second molar, okay? If the teeth is on this side, you extract the patient left side. For the incisors, upper incisors, this one is for the premolars. There is no teeth. Upper premolars.
Upper primo.
There is no upper premolars. First, second, after the canine. We have two teeth. This one, no matter, first or second, right or left,
The same.
the same. But for the molars, no. For the molars, I told you, if this teeth is on this side, it is for this side. If it is on this side, it is for this side. Why? Because you have following the anatomy of the tooth. All right. If a tooth is broken inside, and then you have to use the elevators. The elevators is too much used in dentistry because many patients they come, the tooth is destroyed. Then this one is right side, and you have the opposite side also. Okay. I will go fast again because many people they come late and it's important lecture. This one, you open this and you can see the instrument, and after we speak how we use it. Okay, look, see.
Upper straight force.
This is the first. If it is closed and thin, it is for the roots. If it is slightly open, it's for premolars. All right. See, this is for the premolars. No teeth over, like this, right or left side. Upper. The upper is in this way. It's slightly curved, but once it is angled, it is for the lower. See the way of handling? If the tooth is here, so it is on the left side. First, second molar, okay?
Yes.
See here, both is having. This one is on the left side, so extraction on this side. This one on the right is for extraction of the upper. First, second molar, all right? Do you remember? No teeth, premolars, upper. Right, left, no problem, okay? This is for the upper wisdom tooth. See the shape, how is the upper, okay? This is the shape. This is for if the root is inside the alveolar bone, it is for the upper remaining roots. This is the forceps. For the lower forceps, you see it is small. Why? Because we have to go in the narrow, deep area. This is for the remaining roots in the lower jaw. If it is slightly open, I told you it is for the first, second molar, premolar, and for the incisor, inferior incisor. First, second, and the canine. Okay? All this you can do extraction with this one. All right? And it is angled. See how it is angled?
9G.
Yes. This is the one. If there is two teeth, like this one, yes. If there is two teeth like this one, this is the way of handling. You take the patient mouse on this side and start moving. Okay?
Two teeth together?
No, not together. One tooth, first or second.
Yes.
Or you can use it on the opposite side.
Also,
This one and this one. Yeah, both sides it work. Not like the upper first, second. The first, the upper, the teeth, you have two forceps to remove molars, upper molars.
Yes.
You remember? Otur. Okay. So this is the elevators, we talk about it. You have the straight elevators to remove the remaining roots. You can see the remaining roots, please. Because sometimes the root is very deep inside. You cannot go with forceps, then you have to go with elevators. If the remaining roots is very deep, you have, especially in the first lower or upper, no problem. You have to go with this apex elevators is called. Okay, it is sharp. You go down deep and try to take the elevators out. See the many different kind of elevators to remove remaining roots. This one is called Crier's elevator. That when you have a wisdom, when you have a first molar, second molar, you separate them. You have two roots. You remember. You use this one to remove one root, and the other one you go inside the alveolar bone and remove the other bone, the other tooth. So it's called, remember, Crier elevators. Now this one is called winter elevators. You should be careful. It's both the same, but only the handle is more stronger. You should be careful during extraction. Don't give too much force because you may fracture the bone. Okay. This one we use it to extract wisdom teeth, but you should be good professional, and it's used by many doctors to cut the ligament. Always before extraction, we cut the ligament around the teeth. So we use this one, which is called Syndesmotum droite, or we call Warwick James elevators. Okay, this one straight for the upper, and this one to cut for the lower ligament. You see, once you see it is curved, it is for the lower. All right. So okay, we finished this lecture.
Wow,
Let's go.
music.
Let's go for second lecture.
This is the better one.
Yes.
You take photo for this one also.
I like this photo.
Look, we are going to speak about sutures, needles. Yes, this also. Every lecture I choose for you, it's important in your life.
Yeah.
We will speak about sutures. The sutures. Okay, that is one suture you can give me here.
Which one?
Yes, the red one.
You need it, doctor?
لا وهين
If you want.
موسى
No, I know.
Later. The sutures available in the market, it's come like this. Sterilized, suture,
yeah.
stitch. Any wound in the oral cavity after extraction, this suture come in the market like this. All is sterilized. If you see it, it is open, it is finished. No more sterilization. All right. The way it's mentioned here that this suture is 50. It is a polygluton monofilament, and is giving you that it's mean non-resorbable. You have to know these words. It's mean it's non-resorbable suture. It's mean that after a period of time between 5 to 10 days, you have to take this out. The patient have to come to you. It's not resorbable. The resorbable, now I am going to show you. And this one is showing you the needle type. What it is, the needle.
So simple.
How much long it is, how much curved it is, how much circle it is, what is the diameter of the needle. 50, it's mean too much thin. We use it to stitch the skin to give you aesthetic result. If it is 0, it's mean sick. 10, 20, 30, 50, all coming down. The eye surgeon use 90. As much go microscope because he is working. As much the 0 is high, it's mean very thin. Don't think that it is more bigger. No. Below 0, all is coming down. In dentistry, we use 40, 30. 50, if the gum is too much thin, fragile, we go for 50, but not much. For aesthetic reason, the skin wound, we go for 50 usually. All right? So it is written here all, the expiry date is written, and everything. Like this one is not allowed to work because it is expired in 2008. We cannot.
Expired?
Yes, this is the reason I am opening it only for teaching purpose, but I am not using in patient mouse. All right? This is all information is necessary to you. It's showing you how much long it is, this suture. It is 13 millimeter. Okay? Okay, let's speak now about suturing, and you will know. What is the goal of suturing? Why we use suture in dentistry? To aid in for the wound to be healed, to stop bleeding,
Yes.
to avoid wound infection, because if the wound is open, then infection may happen. Assist hemostasis, because many wounds after extraction you will see bleeding happening. So once you suture, you are closing the vessels by suturing. Okay. Produce aesthetically pleasing scar by approximating skin edges. This is the wound. If you close it nicely and you do nice suture, the healing will be aesthetically. This is the reason we say to the patient that we did aesthetic suturing. Why? The edges approximate very nicely. But if you suture like this, then the scar will be very bad. All right? Okay.
It should be like a hamburger.
Historical landmarks. The earliest records of surgical suture date, it started in Egypt, 3,500. Okay. Very, yes. The oldest physical evidence of surgical suture date, no need for that. Hippocrates first used the term suture. Hippocrates is the one using it. This is about the history. They started using by the cotton, and they started using by silk, and they used stone as a needle because there was no needle before. This is the history. You read it, how it started using. Okay. Also, the first started in life in this age, 1,860,000 by called Joseph Lister. He is the first one attempted to sterilize it. The first was too much infection because there was no sterilization. He is the first one started sterilizing by using carbolic acid. But also it was not successful because this one was toxic material. In 1869, he changed to catgut suture. The catgut suture, أمعاء الخروف أو أمعاء. Okay, this is the catgut. It's come and it is goat. Yes.
Goat.
خروف. catgut من أمعاء شو اسمه مصران شو اسمه. This one is resorbable. This suture it will resorb alone. This catgut, if it is used as it is, within 4 or 5 days it will be resorbed immediately. But if you need the wound not to be open, you want it to keep it little more, then we are using catgut, coated catgut.
Yes.
Coated catgut, that means they put material on the catgut to keep it little more long time. It will stay about 10 days. All right. So don't forget, you have chromatic catgut, which means it is covered with layer, or catgut plain. Catgut plain, there is nothing over. It is very fast resolved. Okay. This was covered in Germany, and this company is still going on till now. And his trial to sterilize it, it was very good. And so remember in this. Now this company is called Johnson & Johnson, was the first company to mass produce Joseph Lister sterile catgut sutures. Okay. This is all the history, you read it, and they started selling it in the market. Wound healing. Phases of wound healing. How we start, look, any wound come to you, how the healing start step by step.
Yes.
First, the coagulation begins immediately following injury, you remember. After that, this is the epithelium on the skin. They start coming تزحف.
Yes.
Approaching, start epithelialization between after 48 hours only. Repair should occur within 48 hours of suturing. New blood vessels also grow peaks at 4 days. New blood vessels start to come to the new area to heal, because no wound can heal if there is no blood supply. تغذية بدها تاخذ. Okay. The collagen, الألياف الغرائية, the collagen reformation start also the same as at 48 hours, like the epithelium. Peak at 1 week and continue for 12 months, 1 year. Still collagen is forming. Because when we suture a wound, you remember after 6 months we can know that this wound have aesthetically nice. After 1 month it's look very bad, it's not nice. So you cannot judge immediately that this wound is good or not. At least need 6 months to 1 year that this scar to become nice. Wound contraction starts 3-4 days and can last up to 2 years after the injury repair. So the wound is not stabilized after suturing immediately. It's need 3-4 days. Start contraction. يعني بتحاول تبعد عن بعضهم the wound. This is the suture should have special properties that elasticity and not harming the wound when you are suturing. It's coming in the lecture, okay?
Yeah.
This is the reason when there is a traction, the wound to open, and this one have to relax, keep the wound nicely approached together, okay? Factors limiting wound healing. Why this wound? Sometimes we do suture and the wound will not be healed nicely, or will have bad scar. What is the factors which is limiting this one, inhibiting this problem? You have the steroids, cortisone, sepsis, التهاب موجود, malnutrition, if the patient is not taking good elements, diabetics, the immunity will come down, obesity, سمنة, smoking also, because the heat reduces the blood supply, which is very important. There is no nutrition coming enough to the wound to be healed by the heat of the smoking. Chemotherapy and radiation, if the patient is on chemotherapy, all right, and because chemotherapy also will reduce the blood supply, and radiation also will cause radiation معالجة شعاعية مثلا patient cancer after the cancer the patient will go chemotherapy or radiation. If they give radiation, the area blood supply is damaged, then also the healing will be not good. Anticoagulant, if the patient is taking heparin or warfarin, like somebody in heart disease or something like that, also will not heal nice. Antiplatelet medication, you know, if the platelet count is about 150,000 in normal in the blood, if it is less 100 or 50,000, then the platelet will not join together to do a fibrin. All right, the healing will be not nice. Collagen and vascular disease, vessels disease also will not be. Local factors, dirty place, local itching or thing like that will not. You remember always the skin, anybody's skin or oral mucosa, it is like that. The first one is the squamous epithelium, epidermis we say. Below this, from here to here, is called the dermis. So the epidermis, they have the keratinine cells. The epiderms, they have the layers, the squamous layers, and the basal. This one is called the basal cell. You know, in cancer, if this basal cell is penetrated to the dermis, then the cancer, we say class 1, class 2, class 3. You remember this one, all right? So you have the epidermis, you have the dermis, epiderm,
But skin cancer or any cancer.
any cancer, the skin or oral mucosa, if it is penetrated deep, that's mean it is gone to second stage. We say grade 1, grade 2, grade 3, all right? Any cancer. Cancer start from the epithelium or start moving from secondary cancer. If this one is gone to the histopathology, the histopathology will tell us this one is called red pig. The red pig is, it's me. ايه سارة؟ الو. اهلين سارة، اهلين تفضل. الحمد لله الحمد لله، كيفكم انتم؟ اهلين. اللي لسه. انا بالشغل انا اليوم. ايه تفضل. بالبهرميان انا اليوم. ايه تفضل. شو اسمها؟ ليلى. الو. إيه. معالجة الأطفال يعني معالجة سنية للأطفال أو معالجة جراحية للأطفال. ما عندي مشكلة، هي امتى بتحبوا؟ يوم الأربعاء أعطيكم المحاضرة يعني؟
No.
طيب. الجمعة حتكون محاضرة، ليش؟ يعني هذا يوم إضافي حيكون غير الأربعاء يعني؟